Hi, everyone. Welcome to Eating Disorder Connections, where we are live and connected. I am Kayla Carson, Regional Director of Clinical Partnerships for the Selah Eating Disorder Network, which is comprised of Magnolia Creek, Selah House, and Toledo Center for Eating Disorders. We focus to meet clients exactly where they are in their recovery and provide the necessary therapeutic techniques to empower sustainable freedom. Our expert clinical teams help clients understand recovery is truly possible by using individualized treatment plans comprised of a combination of evidence-based treatment modalities. Our goal is to make each client feel safe and close to home by conducting our care in the comfortable home-like settings designed to offer a clear step-down process so clients feel continually supported in their recovery journey. We are excited to be talking about our programming for women with co-occurring substance use disorder at Magnolia Creek today with our Regional Director of Clinical Partnerships, Suzanne Arnett. Suzanne, I'll let you share a little bit more about Magnolia Creek and introduce our teammate, Dr. Danielle Hagood.
Absolutely. Thanks, Kayla. A little bit about Magnolia Creek. It's outside of Birmingham, Alabama, in a rural area. And on our campus, we have a large home, as Kayla said, a large home-like setting. And within that home, we have 14 beds as well as 8 beds and a smaller home across the driveway. Also on our campus, we have a beautiful lake and just a wonderful campus and grounds for clients to feel at home in a peaceful setting, practice mindfulness, and start their recovery journey. And today I'm excited to have with us Dr. Danielle Hagood. She's our clinical director. Dr. Hagood, thanks for joining us.
Thanks for having me.
Absolutely. Now let's talk about co-occurring disorders. So why is it important to treat the eating disorder and the substance use simultaneously?
Sure. There's a few major reasons why it's really important. The current literature that's out right now and that's coming out really suggests that there's a high co-occurrence between substance use disorder and eating disorders. So historically, what's happened is that clients or individuals that have sought out treatment have been, geared towards either the eating disorder treatment or substance abuse treatment. And what happens is, for example, if a client enters treatment for an eating disorder, they'll be working on their eating disorder, but then almost all of the times the substance use disorder will flare up, and vice versa. So it's really important to be able to treat both of them at the same time so that the individual can really get a handle on what skills they need to use, what works for them. They can discover their support system and really implement all the tools that they're learning in treatment for both of these co-occurring disorders.
Well, clinically, thinking about that, how is that accomplished in our program?
Sure. So we provide residential care as well as partial hospital treatment. And what we provide is a really structured environment with multiple groups throughout the day, individual therapy and family therapy. And what we use is evidence-based treatment, which, as you stated previously, is cognitive behavioral therapy, dialectical behavioral therapy, and family systems work. And we also do a lot of mindfulness practices. And all of these modalities, through research, where we know that they are really, truly effective in the treatment of the co-occurrence of substance use disorder with eating disorders.
Okay, so once someone goes through our program, towards the end of her stay with us, we start looking at what's her life going to be like after treatment. So what does aftercare look like for women specifically struggling with both substance use and eating disorder?
Sure, that's a great question. And the way we look at it here in Magnolia Creek is we start that process of aftercare planning on the day that they admit. So we want to be able to provide them with a support system that's going to hold them accountable, allow them to talk about things that are going on, and help them, people that are around that can help them, support them in using the skills that they've learned in treatment. So what that practically looks like is outpatient dietitian, outpatient individual therapist, psychiatrist if needed, a primary care physician. A lot of times 12-step support groups are incredibly helpful, and we offer those here on campus as well. And all of those function as a way to kind of wrap around the client and support them in their recovery journey as they leave treatment in Magnolia Creek.
Okay, great. Thank you, Dr. Hagood. We lost your photo for just a minute. We've got your sound, but not your picture. There you are. Okay, we'll get back to that. So that sounds very thorough, that, you know, we make sure that a client leaves us with a full treatment plan and the next step, you know, to work on. Well, I think Kayla is going to tell us about how, if someone's interested or perhaps they have a loved one, how they get to us. Kayla?
Yeah, and I think something that's really great I've experienced working with a team at Magnolia Creek is also working with clients who might step over back to their sober living environment that they came from when they came to us, and also working with our certified substance use disorder therapist on that piece as well, which is just such a unique thing to have in an eating disorder treatment program. And we're just so thankful to be a safe landing place for women who are dealing with both. And so for more information about our eating disorder network of services, or if you know someone who is suffering from an eating disorder, we are here and we're ready to help. You can visit our website at www.magnolia-creek.com or -creek.com and contact our admissions team 24/7 at 205-678-4373, or private message us on social media, Facebook, Instagram, Pinterest, LinkedIn. We are all over social media as well. And so please connect with us if you know someone or yourself is struggling. For myself, Suzanne, Dr. Hagood, and the team at Magnolia Creek, we really thank you for joining us today. And again, we are here, we're ready to help, and we invite you to come and walk with us into freedom. We'll see you next week. Bye, everybody.